All right, are we ready for the next one?
Yes.
Yes.
Okay. This one, our pre-op, we have a right knee tight lateral retinaculum. We have procedures, right knee arthroscopic, lateral release, and resection of the medial plica. Post-op, same diagnosis. The tight lateral retinaculum and the medial plica. We see in the indications we've got pain in the right knee. And the MRI revealed a tight lateral retinaculum. Right, in the procedure, after the prep, a hypermobile medial meniscus, but no tear, and tight lateral retinaculum was noted. All right, so using a combination shaver and the arthrocare wand, the medial plica was resected and the lateral release was performed from the superior pole and the superior-lateral pole of the patella to the infero-medial pole of the patella. So what are we getting from all of this is basically the release and the fact that they moved the plica. I think the codes on the CPT, everyone got that. I want to talk about the diagnosis, and I want to show you something that I was able to find this week. All right, so we have, okay, we have the right knee lateral retinaculum. It's tight. All right, so what we're trying to determine our code for this. And this is the code that we should have arrived at. And I am believing that basically we did. But I want you to see an explanation of what an internal derangement of the knee is, because this is something to make note of for orthopedic coding. An orthopedic specialty is not something that you typically start out with in your career. This is something you build up to. But that does not mean that if you're working for a family practice physician, that this patient's not going to come in with a diagnosis. This family practice doctor is not going to do the surgery, but you may have the diagnosis. So this IDK, and I kind of like this little picture, typically means I don't know, rather than internal derangement of the knee. But I want us to look at the definition. Internal derangement of the knee is the term used to cover a group of disorders involving disruption of the normal functioning of the ligaments or the cartilages, the menisci of the knee joint. And this was just a picture that showed us this would be a torn meniscus. We did not have a torn meniscus. So when we see that this patient has a retinaculum that's tight, we're like, okay, we've got to figure out where we get this from. Where do we get this code that is correct, M23.8X1? And that code is other internal derangements of the right knee. But this is where I started. And I know that each of you may have started in a different place, and that's fine. But for those that didn't get this, it's important that you know where to start. I went to disorder of the joint because tight retinaculum is not in your index. So I went to disorder of the joint, and it sent me to derangement. See, derangement joint, derangement knee is where I ended up at, and I used specified, not elsewhere classified, because I know what's wrong with this patient. It is specified, but it's not in the code book, the encoder with this specific diagnosis. So it is definitely specified, not elsewhere classified. So that's M23.8X1. And then I identified the plica of the right knee, M67.51. Now, all of you were able to arrive at the 29873 with RT for the modifier. But we also had an S83.011A. Now, if you Google how to code tight lateral retinaculum, you get this code. But then you've got to look it up in the tabular. And it's a traumatic current injury. This patient did not have an injury. So you don't want to put an injury code on a patient's chart if it's not specified. So you want to be real careful that when you find a code, and a lot of us Google, I've Googled to get some help and direction before, but you still got to go back to the tabular and read it and see if it is the definition that you need. All right. M25861, that is a specified joint disorder. We can narrow this down more so with our M23 as an internal disorder of the right knee, more so than we can other specified. Now, this M67.57, I honestly think that was a typo for our M67.51. But I brought that up only because I want you to be careful, because when you're keying in on the job, you don't want any typos. And then our 29875 that we might have used is a synovectomy. So it's a good idea to go back and read the definition for this code, because that is a specific procedure that was not done. There is no indication here that there was a synovectomy. Removal of synovial tissue. That was not performed. Okay. This was resected right here to get to the release. Means it was cut.
For the second scenario, the part that says the joint was then suction dry. As I actually coded the synovectomy, hoping it's the suction process, the removal of the synovial fluid. That was my thinking.
Yeah. Actually, that is just part of the process to make sure to get all the fluid out of there. Once again, and I was watching procedures this morning on another question, but that's a really good YouTube to look up and understand. But a lot of times in orthopedics, you're going to see that they suction at the end of the procedure because they've done all this work. they've cleansed it with saline and other methods of cleaning, and they've got to get it dry. They've got to take all that liquid that they put in out. So you will see this term right here more than once. You'll see that often. But I see what you're saying. Yeah. But does what I'm saying make sense?
Yes.
Okay. See, it's right at the end. It's right as they were closing up. Good question, though.